Welcome, and thank you so much for joining us today. We are here really talking about going beyond and advising PAs on the appropriate influenza vaccines for their patients. And let me just start by welcoming you. Thank you for being here. We're talking about something that is near and dear to all of us as PAs. My name is Dr. Jennifer Orozco. I am the Chief Medical Officer of the American Academy of Physician Associates, and I'm very excited to be here today. This discussion is supported by Sanofi, and it's a really important one about flu season. As we're coming into flu season, we've really gathered a group of experts here, which I'm so excited to talk to help shed light on the importance of flu vaccines and really the role PAs play in educating patients so they can be prepared for this season. So first, let me talk and let me share by first welcoming our guests. And I'm going to go kind of round robin here. And first, I would like to welcome Takeia Horton, who is on a mission to increase the number of minority PAs in practice today and really help alleviate healthcare disparities and build trust between community and medical providers. Takeia received her MPH from Rollins in 2009, and she served as a research project coordinator at the Hope Clinic of the Emory Vaccine Center for several HIV prevention and vaccine trials, including a faith-based educational intervention to reduce health disparities and to increase minority participation in clinical trials. Following her position there at the Hope Clinic, she went on to earn her Master of Medical Science degree in PA Studies from Emory in 2014, and she spent 5 years with the National Health Service Corps, providing healthcare to underserved communities with limited access and limited resources. So PA Horton, thank you so much for being here today. We're excited to have you part of this panel. Next up, I would like to welcome Dr. Sarah McQueen, who is a family medicine PA at an FQHC that serves Northeast Tennessee and Southeast Kentucky. She graduated from the University of Kentucky PA program and graduated from the inaugural class of Lincoln Memorial University DMS program. She currently serves as the vaccine coordinator for her 5-site clinic system and is also the school-based health center director. She is the AAPA's representative to the ACIP Combined Immunization Schedules Work Group, and she is passionate about preventative medicine, education, especially immunization, and personally participates in vaccine trials when they are available in her area. Thank you, Dr. McQueen, for being here, and we're excited to talk with you. And finally, we are joined by Dr. Melissa Soester. She is an assistant professor and research director at the University of Nebraska Medical Center PA program in Omaha, Nebraska. She graduated from the University of Nebraska Medical Center in 2005 with a master in PA studies, and she obtained her PhD in health sciences from the University of South Dakota in 2021. She spent the first 2 years of her career providing family medicine and emergency medicine services in Eastern Colorado at a federally qualified health center and critical access hospital. She spent the next 11 years working at a rural health clinic and critical access hospital in rural Nebraska, practicing in the areas of family medicine and emergency medicine, providing medical care for patients of all ages. She continues to work in urgent care while serving as a full-time faculty member, and she is the current president of the Nebraska Academy of PAs. And let me be the first to say that I am among giants here with these PAs who have a lot of expertise in a lot of different areas, and we are so excited to talk about this. So let me set the stage here for what we're about to talk about today and why this is so important. And really, the purpose is to highlight the urgency and talk about prioritizing patients to get flu vaccinations. And all of us here on this call know that PAs work across all specialties and care settings. And across the country, PAs conduct more than 500 million patient interactions annually. That's a huge number. We evaluate all types of patients who may be seen at greater risk from complications of influenza. And really, as frontline providers who really interact across the entire spectrum of care, there's really a natural role for PAs to help educate their patients about flu vaccine options, especially given some of the declining rates. So I thought, Melissa, maybe we could start with you. Can you help us understand a little bit the high burden really associated with influenza and some of the statistics that we know about the flu as well as flu vaccination? So I thought I'd pass it off to you. Can you share with us a little bit about that data and why this is so important?
Absolutely. The numbers, truly tell the story of how many patients that we're seeing that test positive for the flu. We're seeing anywhere from the 9 to 41 million range of positive influenza tests in a given flu season. Out of that number, we're seeing a significant number of hospitalizations, up over 500,000, and some of those, unfortunately, are resulting in death. So there's a significant amount of morbidity and mortality that we're seeing with patients that are testing positive for influenza. So there's no better time than now to really have some conversations about what we can be doing as PAs to reach our patients and help them get the most appropriate vaccines.
You shared a little bit about the amount of deaths that we see in vaccines. And I think all of us on this call, regardless of whatever specialty we work in, we have a lot of our patients who don't actually believe that this is true. And the numbers don't lie, right? And it's a big range, 12,000 to 52,000 deaths. And, one in my mind is one too many. So to actually in this day and age see that many people that are dying still from influenza is really astounding to me. So let's shift just a little bit and really talk about another alarming statistic, which is only half of all adults were vaccinated for the flu last season. Only half. So maybe, Melissa, I'm going to go back to you here for some of these statistics, but can you share with us whether it's age or ethnicity, where are we, what are some of the numbers that we're seeing in this only half of adults?
What we're seeing is that individuals over the age of 65, which we know to be at higher risk of complications, more than half of them are getting their flu shots, but those that are under the age of 50 in the adult range, so about 18 to 49, we're only seeing a little over 30% of them that are getting vaccinated. So definitely some room for improvement there, because there are individuals in all adult and pediatric age ranges that may have, other health conditions that put them at risk. You'd also mentioned different racial or ethnic groups. And what we're seeing is that over half of non-Hispanic whites are getting their flu vaccine. But we're also seeing that, some numbers down to mid-30s for Hispanic adults are getting theirs. So the CDC has provided a lot of data on that, and maybe some opportunities for us as practicing PAs to see where we can make a difference.
Takeia, you've done some work in this area primarily. So share with me, what do you think about these statistics, and why is this so important that we're looking at race and ethnicity, especially when it comes to flu vaccinations?
I think that what's really important is that there seems to be this vaccine hesitancy amongst different communities, whether it's racial or ethnic breakdowns. And a lot of it stems from, unfortunately, previous stigma and medical racism and issues in medicine where people may not trust their providers, which is why it's really important when we're talking about vaccinations or any sort of health care is that you're seeing a provider that you can trust and you can build a rapport with, but also that we're really listening to our patients, building a relationship with them, and making sure to explain all of this information to them. They may not know about the increased risk of hospitalizations from flu based on age and chronic other medical conditions. And it's really something we have to sit and explain with them in a discussion and just bring this information to them, answer all of their questions, and then help them come to a decision. And it's really a mutual decision making. You're offering and you're recommending the vaccination, giving them all the information you can, while also trusting them to make a decision for themselves and be well informed. And you're bringing that information that they may not have access to.
We're going to talk about informing here in our next segment, and really not only informing yourself as a PA and as a provider, but how that information that we obtained can then be shared with our patients, and why that's so important to help them understand and really meet them where they're at. So stick around. We're going to talk about in our upcoming segment here some really important topics, and I hope that you're going to join us.